morning, good afternoon, good evening, everyone. I'm pleased to be here to be talking to you about infection control for occupational health specialists. I am going to be using the WHO guidelines. And what I'm going to be doing is to look at the core components of the WHO guidelines for hospitals, for healthcare facilities, and then helping to relate it to non-healthcare facilities. So, you know, I know that most people do not work in healthcare, so you don't begin to worry about, you know, how does this relate to me? What's this got to do with me? Okay, so the WHO core components, there are 8 of them, and that's what you see here. You know, that help to build a good, solid infection prevention and control system for healthcare. The way the components relate is what you're seeing here. So the 4 real components are the guidelines, the education and training, surveillance, and then monitoring and feedback. Now, these are enabled by, you know, the workload, staffing, and bed occupancy in healthcare, and also the environment and the various materials that are available for use. And of course, it's directed by the infection control program. The thinking is that, you know, it's best to use a multimodal strategy, which is what you're saying here. So I'll just go into this very quickly. The first component, the first core component is said to be, or is the infection control program. The advice from W.H.O is that all healthcare organizations should have a program that's been developed for them. All right. It's advised that you look at the national standards and any professional standards that are available in your environment. But the organization needs to have develop a program and have a team that runs this program. And so that's what we do in healthcare. Usually we have a program that's developed by an infection control committee. We have an infection control lead. Now, how does that work with other facilities? What I am advising, you know, with this talk is that as you go back, you need to think about having an infection control program. That infection control program, of course, should take into consideration what is relevant to your organization, what's relevant in the context of your nation and all that's going on around you, relevant to the tasks that are, you know, being done in the organization. So if you're a school, for instance, you need to understand, apart from COVID, you need to understand chickenpox, you need to understand measles and how to handle it. You know, all the infectious diseases that are relevant to your specific organization, you need to think about. You need to look at the team. Think of putting together a team. So the occupational health and safety person is most likely the one that will carry the load for infection control. So you would need to educate yourself a bit more. So it's great that you're here today because you're going to be hearing quite a bit from Kevin as well about, you know, what infectious diseases and how to manage some of those things and setting up a program. But you would need to educate yourself and you need to put together a team. The team does not have to be a team of experts, you know, infection control experts, but just having a team of people who would work with you and implement what you put together is going to be important, and having a plan. As you put together that plan, please remember to think about what are the regulatory bodies that are in your environment that you have to work with, that you have to look at their guidelines and all that. The second core component is having guidelines, standard operating procedures, which you would need to develop. You would be adopting some, developing some. But always, again, think of what is available locally to you, because, you know, WHO guidelines provides very generic structure for all organizations across the world. So you need to make it work for you. You need to make it work for your organization. But at the minimum, as you see here, you need to be thinking about things like hand hygiene and aseptic techniques. Hand hygiene is possibly the single most important means of preventing spread of infections. So you need to be thinking about hand hygiene. You need to be thinking of how you would decontaminate the environment, the equipment that you work with. Some you would need to decontaminate almost every hour, depending on if it's high touch. Some you don't need to decontaminate for 2 to 3 days. You would work that out, you know, as you go. But you need to develop the standard operating procedures that would fit that, you know, environmental cleaning, waste management. Think about immunization for your staff. You know, what relevant immunization is available for them to protect them. Okay. The third component is education and training. So it will not be just the person who is leading the infection control that would receive the education. All staff should receive some form of education. And that would often be, again, relevant to their task and what's going on in your community. So sometimes you may have an industry where there's really not much risk of infection related to the job. But what's going on in the community? We've had all kinds of things, at least in our end of the world. We've had Lassa fever, we've had Ebola, we now are running with COVID, you know, the different things. So you need to think about not just what's going on in your industry, but you need to think about what's going on in the community and provide education to the staff. So think about making the education hands-on so that they can learn. Think about running drills, because when you put on your preparedness plan, you need to make sure that that plan works. And so it's part of the education that your staff will be having, and you know, hands-on training. Communicate regularly with the staff so that you keep them abreast of what's going on in the community, in the organization around infectious disease programs. There's a lot of junk on social media. It would be great if you could be the trusted source of information for them, so that you know, they get the real deal, they understand what's going on. So of course that means a bit of work for you. You have to do a lot of research. Surveillance for healthcare organizations. We need to be surveilling for hospital-acquired infections, you know, and we do have a list of them that you know, are advice that we work with, you know, using different methods of surveillance. For non-healthcare organizations, again, it would depend on what is relevant to your organization and what's going on in your community. But you must think of active surveillance. So for instance, an example will be in these days of COVID, especially when you work with in rooms where there are a lot of people, you know, apart from keeping the social distance. Do you want to do some kind of screening before people start work? So in our organization, every member of staff gets their temperature checked before they enter into the building. And we have to run through a list of questions of the signs and symptoms that could point towards COVID. Yes, we do know that sometimes it is asymptomatic, but at the same time, we reduce the risk of people coming in with the infection from the community, because they are out in the community, they close work and they go home. So you may want to think about that kind of surveillance. If you have medical centers, you know, the medical centers may be looking for some of these symptoms when people come in. And you need to be providing feedback as well. Now, multimodal strategies, it's important that you use as many strategies as possible. One strategy would not work. So if you develop a program and you don't do education and training, it's not likely to have the impacts that you want it to have. So you need to think about, you know, training the infection control specialists during the program, having all your guidelines, you know, think about champions, you know, appointing champions in the hospital, in your organization that would then take the message. They become the evangelists for you. Think about using posters, all kinds of messaging, you know, to spread the word about the work that you will be doing. It will be important to monitor and audit and also provide feedback. So what are you monitoring and what are you auditing? It will be different things. So if you put together, you go back in, you set up a hand hygiene program. So people have to be washing their hands and using a lot of sanitizers like we're already doing. You may need to audit the use of the sanitizers, the frequency of hand wash, the frequency of cleaning, especially of the high touch surfaces, people responding to the questions, you know, how many people fill the questionnaires that they need to fill for the daily screening and all that. You need to do that because you need to be sure that whatever you're doing is working. If you're not monitoring, then you do not know whether your strategies are working, and you can't then provide feedback to the staff. So if you're monitoring and auditing and then providing feedback to the staff, it's another way of keeping them engaged, including the leadership. You need to be providing feedback to the leadership around the program. Is it working? Is it not working? What's working well? What's not working so well? The seventh core component is looking at workload, staffing, and bed occupancy. That's very key for us in healthcare because the heavier the workload, it's been proven. There's evidence to back that up. The heavier the workload, the higher the risk of going from person to person, from patient to patient, without cleaning their hands, without changing their PPEs, or without putting on the proper PPEs. So how does that relate to non-healthcare? You need to think about, you know, as people coming, how do we maintain this physical distancing that we have been working with, you know, that the nation has, you know, various nations have put in place so far. We've been preaching physical distancing. How do we ensure that we can do this as best as possible? How do we keep that 6 feet? How do we keep people apart during breaks, during lunch? How do we keep people in that distance as they're coming to work, preventing overcrowding? And the component is what we call the built environment, materials and equipment. That is, you know, looking at, for instance, producing and providing hand washing facilities. You may not have that already. So here in Nigeria, for instance, the Hefama, at least in Lagos, has insisted that all hospitals must put hand wash sinks outside the hospital, and patients must wash their hands before they get in. We've had to do some quick work to get those sinks up, but I'm sure it's worth the effort. And you may want to think about such a thing as well. How do I ensure that my staff can wash their hands before going in? Using soap and water, alcohol-based hand rubs. How do I provide alcohol-based hand rubs all over the facility so that people are encouraged to use this? How do I provide waste bins and tissue for those who have coughs and are sneezing, such that you promote good cough etiquette? What do we need for cleaning? How do we provide good ventilation to make sure that we're clearing the air? We have good enough air changes to make sure we're not spreading, you know, any infections amongst ourselves. We've heard of industries, the meat industry. Yesterday I was watching the TV, and one of the meat industries somewhere in the US, you know, has this high rate of infections. We may want to think about, you know, how do we make sure that doesn't happen? We've had the same thing somewhere in Nigeria here, where 31 people in one factory were reported to have developed COVID or contracted COVID. How do we ensure those things don't happen? You know, so looking at the materials and the equipment that need to be provided. So, in summary, I have talked about the fact that all organizations should have an infection prevention and control focus as we go forward. For those who, some may have it already. If you already have it, you may want to review it to make sure that it's still relevant for the current times. And if you don't have it, you want to develop one now so that you're proactive. You are way ahead of any of these infections that are happening there. Leadership involvement is going to be very key. Most of you will be leaders in your organization one way or the other, or you have access to the leaders, and you need to involve them because there may be resources needed. Of course, the support will be needed. They need to walk the talk such that other members of staff are sold to what they're doing. Because if leadership is not involved, it's going to be a bit difficult. You need to have a focal person for infection control. Definitely need to have someone who would be trained if they're not trained already, but they need to get better training. And that's likely you, like I said earlier, most likely the occupational health and safety person. You know, you may need to wear that hat as well. So for those of you who already have 2 to 3 hats, one more. There you go. All staff should receive infection prevention and control education and training as is relevant to their task and the community. That will be key. And then, of course, using the multimodal strategies. Please do not use one strategy. It's not likely to work well. It's not likely to have the effect you want it to have. So think about using multimodal strategies, the training, proactive planning, physical distancing, hand hygiene, and all that, providing the equipment. And of course, making sure that whatever you put in place works. Please do not neglect monitoring and auditing of compliance to the SOPs, to the program at large. And yeah, so providing feedback to staff will be important. Providing feedback to leadership will be very important.